Alzheimer's is a common type of dementia, a progressive neurological disease that causes the loss of brain cells. This condition leads to a decline in thinking, memory, and behavioral functions. Symptoms typically appear gradually with age. It can take years for the disease to reach its advanced stages. In its early stages, Alzheimer often manifests as forgetting recent events. Within a few years, individuals may struggle to carry out daily activities independently. Please don't forget to support our work by subscribing, commenting, and sharing. Social skills, behavior, and logical thinking abilities also deteriorate over time. In advanced stages, Alzheimer patients often lose the ability to engage in conversations, struggle to respond to questions, and find it difficult to understand what's happening around them. While the disease commonly affects individuals aged 65 and older, early onset cases are not uncommon, so it cannot solely be classified as an illness of old age. Before discussing treatment, let's first answer the question, what are the symptoms of Alzheimer's? Symptoms of Alzheimer patients typically visit clinics with complaints of cognitive and behavioral decline. Early symptoms are mild but become more pronounced in advanced stages. Initial signs of Alzheimer's include minor memory problems, such as forgetting recent conversations or events and struggling to recall the names of people, objects, or places. As the disease progresses, common symptoms include confusion and difficulty adapting to surroundings, getting lost in familiar areas, problems with speech and language, aggressiveness, unusual demands from family and friends, suspicious behavior or paranoia, personality changes, including hallucinations and delusions, loss of motivation and self-esteem, difficulty performing daily tasks independently, denying events they can't remember, anxiety and depression. These symptoms are commonly observed when the disease is first diagnosed. As Alzheimer's progresses, symptoms become more severe, leading to patients being unable to recognize family members, remember recent events, or even identify themselves. At this stage, patients often require a caregiver for daily living activities. Causes of Alzheimer's disease has been the subject of extensive research for decades, but its exact cause remains unknown. However, certain risk factors have been identified as potential contributors. Advanced age, a family history of Alzheimer's, Down syndrome, previous head injuries, sleep disorders, sedentary lifestyle, obesity, smoking, or exposure to secondhand smoke, high blood pressure, and cholesterol, poorly managed type 2 diabetes, unbalanced and unhealthy diet. Research shows that Alzheimer's is slightly more common in women than men, though this may be due to women generally living longer. Another area of study involves beta amyloid plaques found around dead brain cells in Alzheimer's patients. Ongoing research aims to determine if these plaques could reveal the definitive cause of the disease. How is Alzheimer's diagnosed? There is no definitive test for diagnosing Alzheimer's. Instead, various medical assessments are combined. Patients showing symptoms of Alzheimer's are referred to neurology clinics, where specialists take detailed medical histories, often involving input from family members or close associates. After this, the following tests may be conducted: neurological assessments of balance, sensory functions, behavior, memory, and reflexes. Blood tests, imaging tests like ultrasound, CT scans, or MRI, depression screenings and personality assessments. Genetic tests for diseases with similar symptoms, including APOE4, a gene associated with Alzheimer's, though this test's validity is not yet proven. Cognitive function tests, commonly referred to as Alzheimer's tests, are conducted to confirm the diagnosis. How is Alzheimer's treated? If you or someone you know shows signs of Alzheimer's, consult a healthcare provider immediately. Following a diagnosis, treatment plans are customized based on the patient's age, disease progression, and coexisting conditions. Although there is no cure for Alzheimer's, certain interventions can reduce symptoms and slow disease progression. Modifying home environments to prevent forgetfulness and improve memory, such as using notes and visible reminders. Cognitive stimulation therapies to strengthen memory, problem-solving, and language skills. Medications like donepezil, rivastigmine, or memantine to manage symptoms. These are not cures but part of symptomatic treatment. For those with a family history of Alzheimer's but no diagnosis, preventive measures include avoiding smoking, adopting an active lifestyle, and maintaining a healthy diet. Awareness of Alzheimer's symptoms is crucial for early detection. If you observe memory-related issues in yourself or a loved one, visit a healthcare provider promptly. Early diagnosis and treatment can significantly slow disease progression. If you found this information helpful, don't forget to share it with your loved ones, subscribe, and like. Stay healthy.